And that sort of brings me to my third point, which is specifically in relation to healthcare. Last year, the World Bank moved Indonesia up into what it calls the grouping of upper middle income developing countries. And what that specifically relates to is that Indonesia has just recently moved past the benchmark of per capita GDP measured in purchasing power parities of $15,000 per head. And the significance of that is that history tells us that countries whose per capita incomes exceed between about $15,000 and $20,000 per head at purchasing power parities are ones where the proportion of the economic activity that's in the form of services starts to grow quite significantly, rather than it being mainly about the production of goods or mining. And within that, clearly, healthcare is going to be increasingly important. Two developments, obviously, since 2014, the rolling out of universal basic healthcare to all the people of Indonesia, to the point where Indonesia is, as I understand it, likely to have the fourth biggest universal healthcare system in the world when it's completed. But also, as I think Pak Nurul referred to this in his presentation earlier, that a significant proportion of Indonesia's population, maybe of the order of 50 million, who are regarded as being the middle class, want better healthcare for themselves and their families than the basic provision. And a number of those, 600,000, I think was the number that Pak Nurul referred to, and I've read that number elsewhere, are willing to go overseas for medical procedures. Now, they mostly go to Singapore and Malaysia because that's close, but clearly there's an opportunity for Australia in that space.